Hey everyone, spoiler alert, I am in the hospital and I am no longer pregnant. So Leo has been born. This is not what this video is going to be about though, because I still need to finish the pregnancy part of HDFN. So this is going to be the last video talking about the pregnancy. I'm going to share the stats with you from the last time that we chatted, and my sixth and final IUT, the intrauterine blood transfusion. And then I'll make a separate video to talk about sort of what happened with the birth experience and what has happened so far on this side of the disease. Quick reminder, HDFN stands for Hemolytic Disease of the Fetus and Newborn. So there's kind of this first phase where he's in utero, and that's what we've been talking about so far. And then there's like a second phase of it where he's a newborn. So that's what we're going to go to in the next video since he is here. He is so cute. He is the best ever. He is in the NICU, so not with me, but we'll cover that in the next video. So really quick, the last time we chatted, I think it was November 8th, and his MOMs were still good, 1.01, so we were all set. And then November 13th, he was 1.23, so creeping up a little bit, but still under the anemic line. And then when we went in on Monday, November 20th, his MOMs were 1.77. Sorry, I'm a little bit congested. So 1.77, he definitely was anemic again, and we needed to go in for our sixth and final intrauterine blood transfusion the next day. So Tuesday morning, November 21st, we went in and did that. We were able to do it first thing in the morning, which is great. That one was probably the hardest one. We were in the OR for 2 full hours. Even though they give him a sedation and a paralytic, after 2 rounds of that, he was still whacking the needle out. So he was done. He was over it. He is super active with his arms. So that was tough. I kept falling asleep, but then the anesthesiologist had to keep waking me up because when you fall asleep, your breathing goes back to normal, and I need to have really shallow breaths to help not have big deep breaths in my abdomen because they have the needle going in there. So that was really hard to stay awake for that long because I'm head sedated, during the surgeries. And so I kept falling asleep, and the anesthesiologist had to keep waking me up so that I would have shallow breaths. So it was a long 2 hours getting that last one in, but it was successful. His starting hematocrit, which is that red blood cell count percent, was 26%. So anemic, we were in at the right time. And then they were able to get him up for sure to 42%. And then after they pulled, they did a little bit more. So they're guessing they got him up to about 45% hematocrit on November 21st. So he was well topped up. They put a good amount reserve in his belly. So overall, even though it was 2 hours and it was long and it was difficult, it was successful. They got everything done they needed to get done. So we felt really good about that. And then after that, our next MCA scan was Wednesday, November 22nd, the day after surgery, and it was 1.15, so we're back down to normal. And then the next Monday, it was 1.23, so normal again, and that was November 27th. And then finally, the last stat for today's video was on November 4th. Today is November 8th, I think. So this Monday, today's Friday, this Monday, his scan was 1.47, but it was also all over the place. So that leads us to what is going to be in the next video, which is getting checked into the hospital and why we did that, and then his birth story and all of that. Oh, thanks, babe.
Cranberry or
Cranberry. So that is, Chris just got back from the Ronald McDonald House, grabbed some snacks for us. But like I said, we'll talk all about that in the birth video. The last thing I wanted to mention for this video, which is, like I said, just our last pregnancy update with HDFN, is a couple things. First of all, is we do have a Target registry. So if I know a lot of people have been reaching out asking how they can help. If anyone is interested, you should be able to find us on Target. We have almost everything we need, but if you feel called to get diapers or wipes or anything like that, you know, we would, of course, appreciate anything and everything. And then the other thing is we are currently running a Leo's stocking fundraiser, and this is for the Allo Hope Foundation that I've talked to you guys about. It's in almost all of my videos. They run the podcast that like taught me everything I know. Their resources are just phenomenal, and I quickly, you know, have been so attached to this organization. And so they run a stocking fundraiser every year, so you can give towards that fundraiser financially, and then they send a little notes with everyone who has donated on Leo's behalf to fill his stocking with this year, and a little gift. So if you want to donate to that, that would be amazing, and I will put the details of that also in the description area. I think that's all I have to share with you as far as our last pregnancy video goes, and pretty soon I'll make a full update of our complete birth story and hospital check-in and how everything that went. So appreciate everyone who's been following along. We are in the middle of part 2 of this fun adventure with HDFN, so keep following along if you want to hear about the second portion of this, and we just really appreciate all the support and the love and the prayers. So we'll catch you in the next video. Bye.